Welcome back to Sketches in Surgery. This is Dr. Earl Stephenson Jr., board certified Atlanta plastic surgeon, and we're going to continue to talk about sliding genioplasty. We're going to focus on positioning the chin either forward or backwards. There are many ways we can position the chin in a genioplasty, and I'm going to break these up into different segments that are short in duration. So we're just going to talk about moving the chin forward or backwards, as I mentioned earlier. So obviously we've talked about in previous videos the process, where the surgery is performed and how it's performed, and we talked about the causes, and we talked a little bit about other factors that play into the diagnosis and evaluation for someone who's seeking correction of their profile via their chin. So now we're going to talk about a prominent chin and a recessive chin. So again, this abnormality, if I can use that terminology, is something that occurs in the side profile, side view, or profile view. A prominent chin is termed macro, meaning large, genia. In a recessive chin, which is more common, and I'll put a star by that, in my experience, it's called micro, which is smaller, genia. So after evaluation, you'll determine if someone has a really recessive jaw, and an extreme example would be Andy Gump type of caricature, or a very prominent chin and jaw, which would be more like a Jay Leno type of caricature. Typically, as I said, in my experience over the last 25 plus years, is that most commonly there is a recessive component more so than a prominent component, but either issue or concern can be addressed with a sliding genioplasty. So how do we do that? If we go over to our mandibular drawing, and it's a lower sketch and illustration showing the mandibular bone, teeth, the mental foramen, and a proposed cut in the bone called the osteotomy. This cut is made parallel so that you can achieve a larger chin segment. It's not made in a slanted or semicircular fashion where you don't achieve much chin stock, which leads you to a smaller kind of button, narrowed, tapered look, which in my opinion for anyone is not aesthetic. So we do not do that. So we have a nice broad segment of chin that we can move whatever way we like. So the incision is made into the gum tissue of the lower lip. The bone is exposed, the mental nerves are exposed and protected, and using a surgical saw, this bone of the chin is divided from the remaining lower jaw. Now this segment, which we'll label S, can be moved in any direction. So we look on the side view because we're really trying to affect the profile view. If we look at that, then this is what that looks like, and I'll zoom in a little bit. You can see that this osteotomy or bone cut goes way back, almost toward the little notch just before the angle of your jaw. I really think that's important because if you look at a lot of videos or illustrations, you'll see a cut that maybe looks like this, with hopes to advance it straight forward in that direction only. If you use that orientation, then you're going to be able to advance the chin because the chin will just slide up that ramp, but it will also change or shorten the vertical dimension. If you make this incision in the bone parallel, then this can only move forward and it does not change increase or decrease the vertical height of the bone. So this blue osteotomy is the preferred osteotomy. So, having said that, if we look down a little bit further here on my illustration board, you can see we've made the cut in the bone horizontal, and so we're able to advance the chin. This is really kind of what you see more on a daily basis of a sliding advancement genioplasty. You can also set the chin back, which is basically a reductive genioplasty, and I'll just put RED and slide the chin back. It is not typically necessary to fill this little step with bone. You can if you think that will help with the lower lip and chin aesthetics to help fill out the tissue or the lip, skin, and muscle, but it's not necessary. These segments are secured by bone plates that are made of titanium and have that construction to it so that it can keep the bone in the right place. Again, for a reductive genioplasty, the bone plate is secured like so. Sometimes the surgeon will reduce this little prominence here, the edge, so that it's a little softer, but not necessary if it's of minor consequence. So this is, again, a reductive genioplasty, and this is an advancement genioplasty. Again, the orientation of the cut is critical because we do not want this orientation, which then moves the chin up, shortening it, and forward. I hope this was understandable. This is just a quick video talking about sliding genioplasty, correcting what I term sagittal, lateral, or profile concerns with clients. Please stick around for our next video when we'll talk about changing the vertical height, either reducing or lengthening of the chin through a sliding genioplasty. If you like this video and want to see more, please hit subscribe or like depending on the platform you're on, and I love comments, so please feel free to comment. Until next time, this is Earl Stephenson Jr., Atlanta board certified plastic surgeon, and you've been watching Sketches and Surgery.